Hey, Dominic, how do you? Oh,
Good morning, everyone. We'll give it a few more minutes just to allow others to join, and then we'll get started and have a brief discussion about monkeypox. Thank you. All right. Good morning, everyone, and thank you for joining today's live stream. I am Dominic Hobson, President and CEO here at Neighborhood Family Practice. And today I am pleased to introduce you to Dr. Prakash Ganesh, who will address monkeypox with us this morning. Dr. Ganesh is a primary care physician here at Neighborhood Family Practice. He also serves as the medical director of the Cuyahoga County Board of Health. Dr. Ganesh also holds a Master's of Public Health. He's an assistant professor in the School of Medicine at Case Western Reserve University, the Center for Community Health Integration. He's also the associate director of public health and general preventive medicine residency program at University Hospital Cleveland Medical Center, which is within the Department of Family Medicine and Community Health. And as you can see, he's quite an expert in public health, and we're grateful to have him here at NFP and also be able to share some information with you all this morning. So, welcome, Dr. Ganesh. First, I would just like to start with the basic question. What is monkeypox, and what are the signs of the disease?
yeah, thank you. I hope you can hear me okay.
Yeah.
I mean, it's a great question, and it's evolving over the last few months, as you guys have all probably seen in the news. It is a disease that has been around since the 1950s. It was identified in Western Africa. It has come to the U.S. in the past, and that was like in the early 70s and 80s, if I'm not mistaken. It is a virus, and it is related to smallpox, which has been eradicated in the U.S. or in the world. And it is not related to chickenpox. I just want to make that clear because it is a common question that if I have been vaccinated for chickenpox, am I safe from monkeypox? And the answer is no. The virus that causes chickenpox is the varicella zoster virus, which is similar to what causes shingles as well. So monkeypox is very different, and the strategies that we have to fight monkeypox is similar to what we have developed for smallpox. and why it was so successful in eradicating smallpox. I would just say, the symptoms are varied, and we've all seen the typical rash that people have developed on the news. But there is also an onset of disease. So if you've been exposed, you can develop disease within 3 to 21 days from that time of exposure. Um, and it often develops as fever, fatigue, nausea, runny nose, sore throat, and can then develop also the rash, which can be itchy, can be painful, and it can be in multiple areas. So it's hard to just define as one single thing, but usually it starts out flat, develops into a bump. That bump could be filled with pus or fluid, and then it can open up, and then you will have dry pus or fluid at that area. It can be very itchy and painful during that time. And then once the skin forms over, that's kind of when you are cured or have cleared the disease and less infectious at that time. And that usually happens in about 3 weeks to 4 weeks from the first onset of that rash. But I'll leave it at that and let it open for questions so we can have a discussion on it.
Sure, sure. Thanks for that. And I would say for the audience, if you do have questions, please post them in the chat. And if we have time at the end, we'll try to get to them and see how many of those Dr. Ganesh can answer. So a follow-up to that is, how would you recommend people protect themselves from infection?
I mean, I think from the onset of this, I think knowledge is power in everything. Having the knowledge of this disease as well is very important, that it's circulating within the community, and knowing the signs and symptoms that you should be looking out for. In a fortunate way, we have been experiencing COVID and have been using extra precautions in that sense. So it has kind of prepared us for other infectious diseases, unfortunately. But knowledge is power. Knowing that you could be at risk or have a rash, you can warn others or change your behaviors to avoid those situations. There are certain high-risk groups, which I'll get into a little bit later, but also vaccinations are available now that target smallpox or monkeypox. I'm sorry, that target monkeypox and can be around 85% effective, according to the last studies that the CDC reported on.
Yeah, thank you. And speaking of vaccination, we do have a vaccination clinic tonight at our Lakewood Community Health Center, which is located at 11906 Madison Ave in Lakewood. And that will be going on from 5:30 to 7 p.m. There are still a few slots open. So if you are interested, you can sign up at the link in the chat. But speaking of that, my understanding is that there is a certain group that have been prioritized for the vaccine. Can you explain which of those groups are prioritized right now and how those were determined?
Yeah, absolutely. The state health department created a priority list, I believe, based on the CDC, and it's a tiered system. The first tier are those that have been directly exposed and identified as being exposed to monkeypox cases. Others include laboratory personnel that are handling samples of monkeypox. And then the second tier is those identified in places of outbreaks, which have been minimal. We haven't seen that many of that situation in our county. And then the third tier is those that are identified at high risk. And that can mean a number of things. And that we've identified as people of any sexual orientation that could be at high risk of exposure to monkeypox. And a lot of times that's a lot of what people believe that they are around and here in their community. People at high risk of having severe monkeypox disease. So those that are immunocompromised, those with immunosuppressive medications, those with HIV, and then also our sex workers, people who exchange sex for goods, or services. This is spread by direct contact with others. So just that rubbing of the skin is often what can cause this, kind of like chicken pox, if people remember chicken pox and how it was spread, similar to that. So currently we are seeing it in the numbers right now. It's in the LGBTQ community, and that's what we've been hearing in the news. But I do want to say that that is not the only community that it can affect. We do see like just this iceberg, and it's probably much more spread than we think. And me myself, just in my clinical practice, I have diagnosed monkeypox cases outside of that demographic, and so I think it's harmful to just state that it is in the LGBTQ community. Because then we miss diagnosing in other people, such as children who can also have severe disease, and such as our other demographic groups that you might care for or be around. And so I think it's important that we all are knowledgeable about what monkeypox is, because we all can get it.
Thank you, Dr. Ganesh. I think we've seen in the past how we have incorrectly responded, or could have done better in during pandemics when we didn't communicate effectively on preparing everyone about the risk. So I definitely appreciate you being very clear that this is not just our LGBTQ community, that it can affect any of us. Again, we would love to take any questions from those joining the live stream. So you can just add a question in the chat if you have them. But I do have just a couple of more things I would like to talk about, Dr. Ganesh. And the first one is the vaccine. Can you give some more information on what the shot is like? What part of the body? Do you have to have more than one series or more than one dose of the vaccine? And just a little bit more information on that.
Yeah, no, that's a good question. People are sometimes surprised when they come in to get the vaccine and are rolling up their sleeves and ready for the pain. But initially, when this all rolled out, we were giving vaccine subdermally in the back of the arm here. Now it's been approved for a lower volume to be injected into the forearm, kind of like your TB test. And it's very superficial, so what we call intradermal. And it is a 2-series vaccination. So we do one injection there in at the first shot, and then 4 weeks later we give the second shot. And at that point, 2 weeks later, you would develop enough immune response to be protected about 2 weeks after the second dose.
Thank you. So it sounds about 6 weeks before
it's called Jynneos.
Thank you. So are there any side effects? I know that was a big concern as we were looking to roll out the COVID-19 vaccine. And of course, we want to be as honest and forthright as possible about that.
Yeah, side effects are often, you can have kind of a local reaction around the site of the injection. So redness, a little bit of swelling. People are reporting fatigue, some kind body aches, and maybe a low-grade fever. It is a live vaccine, but it is non-replicating, so it doesn't. It's a weakened virus, but it is live to stimulate the immune response, but it's not something that will multiply in your body. So if you are taking immunosuppressive medications or have advanced HIV, it is important that you talk to your doctor about taking the vaccine, and also if you would develop a strong enough response while you're on some of those medications.
Yeah, thank you. I would like to pivot just for a quick second. As kids are returning to school, of course, we're getting into football season, and then basketball season will be coming right behind that. Any recommendations or any thoughts on what parents or could do, or what kids or college students, even for that matter, should be doing to better protect themselves And then the same as we, begin to visit and support our local Cleveland Browns and teams like that, and continue to support our Guardians, how can we prepare and keep ourselves safe?
I mean, I think again, knowledge is power. As we get more vaccinations and if we see this spreading more, the expansion of the vaccine will also roll out. But I think generally in the community, the levels are low. It's not anywhere close to how COVID was. There's been a lot of questions about, can I get this by riding the bus and being around other people? Can I get it by trying on clothes at the store? I think the levels of monkeypox in the community are very low. So the risk of getting that exposure is pretty low. And even I would say that would happen in schools or on sports teams. But I do think knowing what it looks like and understanding kind of what risk factors or behaviors or contacts that would put you at risk is important. And with that, I wouldn't be worried about kids going back to school and being exposed to monkeypox. This has been kind of a very slow rise in cases in terms of how COVID was like a sharp rise.
Right. Yeah, well, thank you so much for that. I do want to repeat that NFP is hosting a vaccination clinic tonight for monkeypox at our Lakewood Community Health Center, which is scheduled at is located at 11906 Madison Avenue, and that will be from 5:30 to 7 p.m. There is a link in the chat that you can use to sign up for that. So as we get ready to sign off, Dr. Ganesh, are there any key takeaways or anything else that you would like to add?
I mean, I think there are a lot of vaccination sites coming up now. Our vaccination site tonight, but also all over the community. So if you do miss anything or need second doses, a lot of them are popping up all over town. I know you can find more information on our website at Neighborhood Family Practice, and also the Cuyahoga County Board of Health website. You can also find more information, and also the Cleveland Department of Public Health are all reliable places that you can find more information. And the CDC website also has a lot of good information about the signs and symptoms of monkeypox if you do have further questions.
Well, thank you, Dr. Ganesh, so much for joining us and sharing some of this information. And thank all of you for tuning in and watching and hearing this. Again, this is Dominic Hobson, President and CEO here at Neighborhood Family Practice. And we wanted to, have a session just to share more information about monkeypox and get the news out there about the different vaccination clinics across the region. Thank you all so much and have a great day.